And for the people who joined later yesterday, we were able to discuss aspects of health education, but also again we went to the aspect of discussing strategies for promoting a, for promoting
One
a
sec.
strategies for promoting a healthy promoting health and preventing of disease. And we went through the healthy eating, physical activity, stress management, immunization, and cancer as some of this. Cancer screening as some of the key strategies that we can use for preventing disease, but also as a way of promoting health in our communities. And we were able to discuss the different impacts of public policy and how they impact on the health promotion. And in trying to discuss some of the strategies for preventing disease, we further looked at the consideration for implementing these strategies. And we were able to look at the effective health promotion strategies, and we're able to say that we need to understand the environmental factors, but also there are certain kind of institutions that you shouldn't live up if you're considering to do an implementation of a disease preventing strategy. And we said you can't leave schools, communities, healthcare facilities, workplaces, and online and digital settings. And that led us into the aspect of what we call needs assessment. And this aspect of needs assessment, we're picking it from health education. That before you do a health education, or before you do a health promotion, or before you do health communication, you must be able to understand and do a needs assessment of what that community desires or what their problems are. Because then, if you will not involve the community, you will be doing for them an intervention that they may not need. And we just went through a few slides of needs assessment, and we were able to give it a faster run, where we went through the importances specifically, and we defined what a need is, some of the types of needs, and the involving the target group, and what is a needs assessment. That is partly what we discussed yesterday, and also what the objectives of health needs assessment are. And today we want to do what they call planning your needs assessment. But before we go to the particular discussion we're having today, I want us to be able to understand what is the importance of needs assessment. Because then you're doing when you're doing a needs assessment, it is actually closer to doing a research, and therefore you follow similar criteria as if you're doing a research. However, this may be as fast because it may not deserve or have other aspects of research that may be more comprehensive. So what happens is that when you're doing a needs assessment, it helps you to identify what the community actually wants as the problem, or what the community identifies as a problem. You may think that open defecation in the community is the problem, whereas for that particular community, their issue may be contraceptive use. So why we do a needs assessment is because we want to know the community's priorities, whereas the community may have quite a long or a lot of problems. A community may have a list of issues they are suffering from, majorly you may have to prioritize, and you will need to know the exact need. Benjamin, kindly mute. Thank you. So you may need to understand what the community's utmost priority is, because the community needs vary according to what the community desires. So when you're planning your needs assessment, there are key questions before starting. And these questions, we looked at them and we said what information is needed, why is it needed, how will information be used, existing information, additional information, and data collection methods. So these are some of the key questions you must ask as your needs assessment team. You know, before you go into the field to do this assessment, you should be able to have a team, and this is where you question yourselves as a team to be able to share some of the strategies, but also to question some of your objectives when you're doing this needs assessment. So I had earlier told you a layman's understanding of needs assessment, and I want to just give it to you here because it is very important if you want to do an objective analysis. So a need refers to the gap or discrepancy between the present state, which is what is, and the desired state, what should be. So the need is neither the present nor the future. It is the gap between them. So what is, for example, what is the maternal mortality rate today? Possibly it is 203 mothers per 100,000 live birth. So what is supposed to be the ideal? The ideal is supposed to be that there are no mothers dying, meaning 0 per 100,000 deaths, according to the WHO. So this gap, you want 0 minus 203. So it would be able to give you 203 as the gap or as the need. So it can be normative or it can be negating. Meaning, for example, if you wanted to reduce teenage pregnancies, then you would say, what is the desired teenage pregnancy? Maybe 5% of adolescent women. But what is the current one? Possibly 70% of adolescent girls. So possibly your gap is going to be 65%. So that will be the need that is in that particular society. So that gap or discrepancy is what you need to understand in there. And a needs assessment is a systematic approach that progresses through a defined series of phases. So needs assessment focuses on the ends or the outcomes to be attained rather than the means or the process. So for example, reading achievement is an outcome, whereas reading instruction is a means towards that end. It gathers data from means of established procedures and methods designed for specific purpose, organizational structure, and operations, or a combination of these elements. So a needs assessment, we are not looking at the process. Here, the example is that we don't necessarily look at what are the processes. For example, if you wanted if you're doing a needs assessment to identify in a particular community, you don't look at the type of people you interviewed, or you don't look at necessarily that process, the data collection process, all those. For you, you look at the end. What is then the priority for this particular community? Those are the key strategies or the definition of needs assessment. So the kinds and scope of methods are selected to fit the purpose and the context of the needs assessment. So needs assessment sets priorities and determines criteria for solutions so that planners and managers can make sound decisions. And needs assessment sets criteria for determining how best to allocate available resources. Needs assessment leads to actions that will improve programs, services, organizational structure, and operations. So you may realize that needs assessment has a lot of functions or importances that it plays in trying to impact a program or a project. In this case, we are looking at a health promotion activity. So if you are able to carry out a needs assessment, you'll be able to identify the gap or the need for this community. Say, the need for this community is information on prevention against malaria. So then you can be, having done the needs assessment, so then you can be guided to offer them a health promotion activity on malaria prevention. How people should be able to stagnate their water, clear their bushes, but also sleep under treated mosquito nets. So you can be able to see what are the resources that are needed. What resources are needed for this needs assessment. So checklist for adequate resources, clear aims and objectives, established need, skilled team, management support, lead coordinator. All these are resources that you need. So if you look at the checklist for adequate resources, you should be able to check whether you have enough logistical logistics if you're going to do a needs assessment. Another requirement is, do you have enough personnel? So the resources are different, including financial resources, human resource, we're looking at logistics and so forth. So these are all resources that you need to assess or checklist before you implement a needs assessment program. Similarly, clear aims and objectives. You should be able to have clear aims and objectives from your team on which particular kind of health promotion needs assessment you're going to do. So in case you do not have clear aims and objectives, you may go into the field and struggle to make amends to what your desired outcome is, and you will struggle to find an intervention. Then you established need, and then the skilled, the team has to be skilled, and then the management support has to be there, that if it is a hospital, that the hospital is able to support you by offering you the available finances and so forth. If it is an institution, a non-government organization, the management should also be able to offer you that support. And then you should be able to have a lead coordinator. And if we're discussing a lead coordinator, then we are meaning that we're looking at someone who is going to oversee this process and is going to be able to report. And then we look at other skills, other resources such as time, space, skills, and funding there. So now, what are the steps in health needs assessment? How do you conduct a health needs assessment? That is what we want to look at today in this health needs assessment. One is to define information needs. The second step is to decide on data collection methods. The third is to collect information. The fourth is to analyze information. The fifth is to review findings with key informats. And the 6th is to define priorities. 7 is to make an action plan. 8 is to prepare the final plan. And 9 is to monitor and evaluate. So the first step, defining your information needs. So clearly identify the information needed for the assessment. The current health status of the affected population. You will have to look at what are the mortality, morbidity, health risks, or the potential outbreaks, or the nutrition status of this particular society. So you have to have a clear definition of the information needed for the assessment. So this requires that you do review and have data on the particular community. What are their mortality rates? What is the risk of an outbreak possible of a particular illness in this community? 2, you have to determine the scope and the objectives of the assessment. When defining your objectives, ask yourself, why are you conducting the assessment and what do you plan to do with the findings? For example, if you're working on a program seeking to increase breastfeeding initiation among first-time mothers in a community, then your needs assessment objectives may include understanding breastfeeding knowledge and intentions of first-time mothers in your community. So you're now defining what information you need. The information you need is you want to understand you're seeking to understand the increase in breastfeeding initiation among women who are first-time mothers who have just given birth to their first child. So you'll want to understand the knowledge they have and the intention they have as an objective. But also you will want to understand the perceived assets and barriers to breastfeeding among these first-time mothers. What are some of the barriers that they face? You will want to assess the barriers related to provision of breastfeeding support in local hospitals and after discharge. So you'll want to look at, do they do maternal nutrition counseling? Do they look at breastfeeding counseling? How a woman should regularly be able to breastfeed their child. So you also want to look at, you want to determine necessary training and supports to increase breastfeeding among first-time mothers in your community. Just a moment. You need to determine the necessary training and supports to increase breastfeeding among first-time mothers in your community. So you will then be able, when you set these objectives, then you will be able to understand the type of assessment that you intend to have. You intend to have. Then the other step is to decide on the data collection method. So you need to select the appropriate methods for gathering data. Given your objectives and the resources, consider the target audiences and data sources that will help you assess your needs. Is it most effective to administer a survey to a wide range of community members, to hold several focus groups with hospital administrators, examine existing reports, or directly observe project participants? Sometimes you will need to conduct several complementary needs assessment activities to collect data for a range of stakeholders. So sometimes you may have to use different data collection methods. So here we're looking at, you must select a collection method that is appropriate. Sometimes if you're doing focused group discussions, you may not need to gather men with women. girls with boys. You may not need to gather disabled people with those who I mean persons with disability, or special interest people with those ones who may be what the society calls normal. So those who don't have those special needs, you may have to gather them aside. All these trick, all this kind of organization is in line with trying to collect accurate data. So the type of tool that you will administer, or the method of data collection that you will administer, depends on your target audience. If you wanted to target again hospital administrators, you may not have to gather them in a focus group, because they may not have sometimes the opportunity or the time for you. But you can do a key informat kind of what, getting information from them. So you also need to consider using qualitative and quantitative approaches. So that the advantage with qualitative is that you're able to dig deeper information from people, and you will be able to get a snowball kind of information, because people may be referring you from one person to another. Then you will be able to gather that kind of information. And then secondly, quantitative approaches. And in quantitative approaches, you'll be able to look at figures and digits that are very important in trying to make a decision. So the second step is to collect information. So having chosen the data tools and the collection methods, you should be able to collect information from people, and you ensure that data is accurate and comprehensive. Accurate meaning that people are giving you the right information, and this accrues from being able to ask the right questions and being able to choose the right tools to ask the particular questions. So if you're able to use the right tools, then you will be able to collect accurate and comprehensive data. And these are some of the data collection methods that you can use. You can do literature reviews for data that has been done. You can do focus group discussions. Literature review means that you're able to read through findings of similar studies, and similar studies meaning with the similar audience, but also that have the similar period of time, and possibly they are targeting the same people, but also it may be having similar location, and the demographics of that particular study you're reviewing might be similar. Then secondly, we're looking at focus groups, where you gather people from about I think 6 to 8, and you'll be able to ask them particular questions, and they can be able to answer to you. But you must be technical enough to record and sometimes note down some of these group discussion, focus group discussions. Then we can do interviews, key informat interviews, and you will be able to get people you feel directly impacting in a particular health behavior. Then you are also able to use observation in a community. For example, it is only it may be hard to do observation for addictive substances. So sometimes we had researchers who went to go and observe alcohol use, but also smoking exposure in a bar. So at that point, you may also become a study victim and start taking a bottle of beer, yet you have come to observe how alcohol use impacts people's health. So sometimes observation, you must be very critical when you are observing. You may not go and observe the health risks associated with the commercial sex workers, because it will mean that you are either engaging in the activity or you are going in to go and observe some of those characters. So it may be hard. For such cases, you may have to prefer interviews or questionnaires or phone calls. So questionnaires are there, they may be structured and they may be semi-structured. So the sources of data and information, you access existing information from government agencies, from health departments, from non-governmental organizations, from research institutions, local councils, but also there are what we call the Health Management Information System registers. We have the antenatal care registers, we have maternity registers, we have OPD registers. So all these may be able to help you understand. For example, the OPD register can give you information on the address of people who are attending health services. So you'll be able to understand if you run that data or if you analyze that kind of data, you will be able to understand who actually has better health-seeking behavior by trying to understand how many people are in this society and how many of them access care. So if they can be able to go to a health facility in 1 year, if 50% of the people in that society went to seek health care, then you may be able to come to a conclusion that they have mediocre health-seeking behavior, and you can be able to go further and analyze that kind of information. So after you've collected that information, you should be able to analyze, process, and interpret collected data. Identify what are the patterns, what are the trends, what are the key findings, what are the patterns of attending antenatal care in this society, what are the patterns of attending hospital or institutional delivery, what is the trend of vaccination of children, what is the trend of feeding, what type of foods, what kind of food do they feed on, what is the trend of cardiovascular diseases in this society, which particular age group is suffering cardiovascular diseases. You also go further to analyze such data in terms of age, in terms of sex, but also in terms of location. How many of them are in rural areas? How many of them are in urban settings? But also you go ahead to analyze how many of these societies have exposure to media in terms of what are their income levels, what are their education levels. If the society has predominantly poor people, predominantly less educated people, then you should be able to interpret the reason as to why some of them have tendencies against going for antenatal care. So when you get this kind of data and analyze it with the key findings, you will be able to do that and be able to understand the kind of intervention or health promotion you should be able to avail. 2 is to plan analysis before data collection, and then so when you are before you do your data collection, you should be able to understand using your framework what type of data, but also how you're going to do the analysis, whether you're going to do quantitative analysis or a narrative one. So you consider sampling the society or sampling people in a society. You may not be able to ask everyone, but when you're sampling, you need to consider a key kind of population that you know that influence that particular community in there. So what are some of the pilot survey instruments? So review findings with key informants. So if you've been able to go through your data, you should be able to engage some experts and stakeholders and validate the information that you've been able to get. You should also be able to determine the most critical health needs. You should be able to define what the key priorities for that community are. And you consider factors like what is the impact, what is the feasibility, what is the impact in this society, how big is the problem, how small is the problem. That is when you're trying to do the defining the priorities. You can actually do naming them from 1 to 2 or from A to Z, and then you'll be able to understand which one is a priority and which one is not. So what are some of the aims of priority setting? Why do you have to set a priority that this one is the most important and this one is not? That is very important when you're trying to set that priority. So you have to identify the health priority. Then you have to involve stakeholders. Then the aim is that there is clear understanding of the priority. Then there is effective intervention. Then you define your target group, identify the necessary changes, and you're able to do the resource feasibility assessment. So if you set a priority of increasing the knowledge on attending antenatal care, or increasing the knowledge on nutritional feeding for infants, then after you've identified the priority as a nutritional feeding for children, then you involve the stakeholders. Who are the stakeholders in this regard? We're talking about the men. We're talking about the women, pregnant or breastfeeding women. We're talking about clear understanding of the priority. So people, after you've set the priority, they should be able to clearly understand what breastfeeding, nutritional breastfeeding of infants is. And then you are able to do effective intervention. Does it mean that you have to offer the mothers a nutritional feeding pattern? You draw for them a type of feeding that they must be able to feed on. Another effective intervention, does it mean that you have to empower the men through giving them skills so that they are able to offer their women support? Secondly, you should be able to define your target population. In that case, after identifying your health priority, you can now define your target population as women who are breastfeeding mothers. Then you identify the necessary changes that come along, and you'll be able to assess what resources are there. And the resources can include land where these women can be able to dig some of the nutritious food values, but also some of the resources can be the health facility where these women can be given sample or farms that are demonstrating what type of nutrition you're promoting. So data quality improvement, physical activity promotion, access improvement, mental health support. These are some of the priorities that you can actually set. And you could name them from data quality improvement as 1, physical activity promoting as 2. So these are priority selections, and at the end, you can be able to choose 1 or 2 of them that you feel are important as a priority in that community. So you have to make an action plan after, develop strategies to address the identified priorities. After you've identified the priorities, you outline specific actions and the interventions you're going to carry. Does it involve demonstrating to the farmers, to the mothers? Does it involve having community dialogues because they may be having problems with their men? Does it involve skilling? So you'll be able to identify these strategies. Then at the end, you're able to prepare the final plan compile all assessment findings and the action plan, ensure clarity and readiness for implementation. So from from defining the need up to preparing the final plan, it is very important. And at the last is to monitor and evaluate. So as you're implementing the plan, you should be able to monitor and implement, and continuously assess progress and impact, and adjust strategies as needed. And so this means that you should be able to monitor and evaluate your health promotion activity, or you should be able to monitor reproductive health promotion and communication activities. So this is just a slide that wants you to understand more the resources. So you need to allocate the resources effectively. So if you're doing staff allocation, you should be able to allocate them effectively. Similarly, if you are allocating funding, you should be able to allocate them effectively, but also time and skills, essential for a quality assessment. And you also need to ensure you have sufficient resources as well in your implementation of this needs assessment. So like I said in our earlier lecture, that it is not only being able to this may not only apply if you're doing a needs assessment, but some of the skills cut across even when you're doing health communication and health promotion. So that takes us into an aspect of monitoring and evaluation, but we shall be able to look at that deeply tomorrow, over the weekend. But I would want us to first look at before we go into health monitoring. I just have a brief slide where I want us to look at social marketing, because it is one of the aspects through which, one of the strategies through which we can improve health communication. It is one of the key strategies, social marketing. And social marketing, in this regard, we may not go deeper into social marketing, the 4 P's of product, price, and so forth. We may not go deep into them now, but for this particular lecture, I want us to take it as a strategy for health communication. And then over the weekend, we can look at, having looked at all these modules, the implementation, what to consider for implementation of health communication and promotion, but also having looked at health education, we shall now be able to look at how do we then monitor and evaluate these particular activities or strategies that we have been able to look at. So kindly allow me to share that screen of health social marketing with you as the last thing we're going to look at this evening. Unless we have any questions before I proceed to the next. Do we have any questions? So we don't have any questions. So we want to look at health communication strategies. And in this case, we're looking at social marketing. So health education, media campaigns, interpersonal communication, health literacy, use of different channels such as social media, print media, and web-based platform. Highlight the description, examples of application of each of the above, considerations for implementation. So if you're doing a health communication, you need to bring in the aspect of social marketing. And in this case, you must be able to use the different media campaigns. That is why you see that during the COVID-19, the WHO was using the radio stations, the TV stations, they were using print media, they were using social media, but also they were using their websites to promote the SOPs, or the standard operating procedures for managing COVID-19. And you would realize that in no bit, the entire country or the entire world was able to realize that there is a problem of COVID-19, and they were able to act accordingly on what were some of the ways in which they could implement a reduction of COVID-19 cases in the globe or in the world. So social marketing is the application of marketing principles and techniques to promote health behaviors and positive social change. It involves the use of consumer research, segmentation, product development, pricing, and promotion to influence behavior. So you have to do a research about your consumer, because your consumer in this case is that pregnant woman who needs to come for antenatal care, who needs to come and deliver in your health facility if they are to have a healthy life. So then you have to segment, meaning you have to divide different ways or methods of trying to attract these consumers. And then your product development should be attractive in terms of your packaging. How do you package your product? How do you develop your product? Meaning in the health facilities, how do you handle your clients? Do you handle them in the harsh way? Then if you do so, then you're going to struggle in health, in getting them into your health facility for antenatal or maternal services. Pricing, what is the cost for accessing health care? Looking at the distance, you may not only look at the price in terms of monetary value, you're also looking at what are the costs, what is the cost in terms of transport cost. But also, if I delivered in the health facility, some of the costs include you need to go with your husband. What if I don't have my husband for antenatal care? The woman will shout at me. What are some of the costs? I am disabled, so I may not be able to move. Are there ambulance services? So that takes you into promotion. Are you able to reduce some of the costs of individuals accessing your kind of health care? So that is what social marketing looks at. So some of the examples of the application of social marketing has been applied to a variety of health behaviors, such as increasing physical activity, promoting healthy eating, and promoting condom use. One example is the Truth Campaign, which uses social marketing techniques to prevent tobacco use among young people. So you realize in the Truth Campaign, the pricing, the promotion, but also how they package their message is appealing to the youth, and therefore you are able to prevent them from tobacco consumption. So the last slide there is the consideration for implementation. So we are looking at social marketing requires a deeper understanding of the target audience and their behavior, as well as carefully consideration of ethical issues, such as the potential for unintended consequences or stigmatization. So if you realize you're going to a community that is predominantly HIV positive, you must be able to package information that does not stigmatize. And those are some of the considerations. You need to know what is my target audience. If they are HIV positive, what are their behaviors towards seeking care? For example, towards coming to take their ARV ARV treatments. Then if you're able to have those questions, you will be able to know which kind of message you're trying to do in your health promotion. So that is a very key strategy in health communication. So up to that far, do we have any other questions?